SABC News, independent and impartial.
From an African perspective. That report bringing the time to 11 minutes after 1 o'clock. That was Mlungisi Makhanya, President of the Kingdom of Eswatini People's United Democratic Movement, Pudemo. He was talking there to Kumbero Munjerere. The Zambian government is this February and March expected to get the first batch of COVID-19 vaccines, which it intends to give to some identified high-risk groups of people from that 20% of the country's population. But some of these are targeted have mixed concerns over the development, as Arthur Skopo reports.
It is a pronouncement that has caused a stir among them. Zambian journalists have received the pronouncement by the Ministry of Health that they will be the first, together with healthcare workers, the elderly and border officers, to receive COVID-19 vaccines with critical concerns. Professor Lloyd Mulenga, Director, Infectious Diseases at the Ministry of Health, made the revelation Monday, 11th January 2021, that once Zambia received the vaccines, journalists, medical or healthcare workers, the elderly, and border officers will be the first to get the jabs, saying they are most at risk of being infected by COVID-19 due to their work and their being.
What we are going to receive next month to March, we've got up for about 20% of the population. And that 20% of the population, again, we've categorized it into the healthcare workers. You people are working and interacting with a lot of other people at greater risk of getting COVID, so you need to have access to vaccines. Are they safe? Every drug has a side effect. When you look at the evidence which is there, these vaccines, they are safe.
Professor Mulenga says the vaccines will be in the country possibly February or March this year. Media Institute of Southern Africa, Zambia chapter, through its chairperson, Helen Mwale, welcomes and endorses the idea for journalists to be among the first group to receive the vaccines. In a statement, Ms. Mwale commends government for prioritizing journalists as a risk group for COVID-19. Hence, the vaccines could help the fourth estate. But Zambia Institute of Independent Media Alliance, ZIMA, questions the motive by government to prioritize the media. Now, Jaja Kolibali is ZIMA president.
Our worry is that why now? There are a lot of good things, sweet things that have come to Zambia, and the journalists have never been prioritized.
Chief Executive Officer of the Scoop newspaper in Lusaka, Benny Mundando, has this to say.
Journalists across the country either lost their jobs or had their salaries reduced to almost nothing. But governments saw it fit to empower cadres and some musicians, most of which did not even have any workable business plan. So it is an insult for them to come around and say journalists are among those that are at risk and must be among the first ones to be vaccinated. This is a pure case of hypocrisy. But when it is about vaccination, they want us to be laborers. I mean, the media industry deserves respect.
Not only journalists are concerned with this, but other stakeholders too, like Jackson Silavwe and his organization, Golden Party of Zambia, that are calling for the appointment of a high-level committee of local medical experts to subject the coronavirus vaccines to local trials and verification before being administered to any single Zambian.
The releasing of the coronavirus vaccines to the general public must be treated with extreme caution. Recently, we have seen some developed countries, despite having better medical facilities than Zambia and capacity to procure the vaccines, object the importation and administration of the same vaccines until their safety and long-term effects have been established.
Clever Chilende of an organization that has its focus on HIV/AIDS, called the Treatment Advocacy and Literacy Campaign, or TALC, at a media cafe for journalists in Lusaka, also offered caution on vaccines being made available and administered around the world.
We should also start looking at what type of vaccines are being brought to Africa. The issue at hand is that those three which have got full approval are at high demand in developed countries. And that's the more reason why, as Africa, we should also demand that we get from those which have full approval.
Zambia, in its second wave today, stands at 31,100 cumulative cases, with 21,568 total recoveries, while 9,023 are active cases today, and unfortunately 509 have died of the pandemic. Reporting for Channel Africa in Lusaka, Zambia, I'm Arthur Davis, Scopo.
When I think back to my childhood, geographically, it reminds me of a time where I was black and only struggling, but at the same time, always reaching for something more, something bigger in a South Africa that was hostile.
Hello, Africa. This is 1000 African Voices, and I'm your host, Avurengwi. Join me on Channel Africa every Thursday morning between 8 and 9, and on Saturday and Sunday morning between 9 and 10. Rise, Africa, rise. Channel Africa, from an African perspective.
Welcome back to Africa Midday. The Kearney Executive Mergers and Acquisitions Report on the chemicals industry in South Africa shows that there was a significant slowdown in the chemical sector, which began well before the COVID-19 pandemic and will probably continue into 2021.